If you think talking about mental illness is scary, imagine what happens when we don't talk about it. Join the conversation. Visit letstalkstigma.org.
Hello, I'm Karl Shallowhorn, board member for the Erie County Anti-Stigma Coalition. And on behalf of the coalition, I would like to welcome you to the 12th in our series of Facebook Live events, this time focusing on the state of stigma, understanding mental health challenges within the LGBTQ plus communities. The Trevor Project, a US-based nonprofit organization focused on suicide prevention efforts among lesbian, gay, bisexual, transgender, queer, and questioning youth, released their inaugural study on mental health in 2019 that had 34,000 respondents. 39% of LGBTQ youth seriously considered attempting suicide in the past 12 months, with more than half of them, transgender and non-binary youth, having seriously considered this. In the same survey, 71% of LGBTQ youth felt sad or hopeless for at least 2 weeks last year. And according to a 2017 report by the American Psychiatric Association, LGBTQ individuals are more than twice as likely as straight men and women to have a mental health disorder in their lifetime, and LGBTQ individuals are 2.5 times more likely to experience depression, anxiety, and substance misuse compared with straight individuals. The same report stated that approximately 31% of LGBTQ older adults report depressive symptoms, and 39% report serious thoughts of taking their own lives. When hearing these startling statistics, it's abundantly clear that those in the LGBTQ community face more in the way of mental health-related challenges than the general population, which adds additional stigma to that which already exists within that group. In today's discussion, we're going to explore how the various factors I've just mentioned affect those in the LGBTQ community with 3 experts who each has a unique perspective on this topic. Before I introduce our panelists, here are a couple of housekeeping rules. Our program is for 1 hour. During this time, if you have a question or comment, please type into the comment box and we'll respond accordingly. Today, I'm first joined by licensed clinical social worker Matthew L. Schwartz. Matt is a solution-focused brief therapist and a certified financial social worker in private practice in Buffalo, New York. He's a board member of the Solution-Focused Brief Therapy Association, where he chairs the Conference Planning Committee. Matt is scheduled to complete his Doctor of Social Work degree in May of 2023. He's accepting new behavioral health care patients at his practice, which can be found at Listening Post New York. Let me correct that. listeningpostny.net. His podcast and research can be found at socialworkdesk.net. Next, we have Reverend Susan Frawley. Sue is the pastor at Hamburg Unitarian Universalist Church. She's also the parent and community outreach coordinator for GLYS, Gay and Lesbian Youth Services, located in Buffalo. Sue is retired from a career that includes school counselor, administrator, and sociology professor. She's also a licensed mental health counselor with over 30 years of counseling experience. Sue is a parent and highly involved in PTA work. Our third panelist is Ronald Piaseczny. Ronald is the Continental District Manager for the Office of Resolution Management, Diversity and Inclusion VBA Liaison Office of the U.S. Department of Veterans Affairs. He's also the founder of Niagara Pride, a 501c3 nonprofit serving LGBTQ plus families, serving LGBTQ plus families and individuals in West New York. Ronald attended the State University of New York at Buffalo and completed his law degree at the Widener University School of Law, specializing in civil rights law and criminal prosecution. After law school, he returned to Buffalo and earned a master's in rehabilitation counseling. Welcome, everybody, to today's discussion. So I'm going to start off with a question for all of you, and this is one that has come up more recently in many areas, and it's something that some people, I think, sometimes don't fully understand, which is why I wanted to start with this one. So the use of pronouns, especially pronouns that have not been used commonly, is something that's discussed by many. can you talk about why pronoun use is important to LGBTQ people? So let's talk with you, Sue, about that. Why would you say that's important to discuss?
It's a great one to start with, Karl. One of the things that we've shared from GLYS is that respecting pronouns saves lives. And while we say that pronoun use is something that's more common of recent, pronouns have always been around. It's just how we use them. This aspect of, oh, wait a minute, people are using they and them, and I'm used to she and her and he and him. Well, back in the 1800s, pronouns had no gender. It was they, them, and thou. So we could say that young people are actually taking back language and bringing it anew in some ways to fit their aspect of trying to find non-genderized ways to bring their authentic selves forward. But again, more than anything, if someone does share their personal pronouns, not preferred, personal, it's really important to respect that, to use them to get past your own personal discomfort and work to be more inclusive.
And with that, I'll just add, it's a matter of respect.
Yes.
Absolutely. So Matt, what would you say about this?
So I think it's important for a lot of reasons. First, solution-focused pre-therapists, and I think all therapists really view our clients as experts on themselves and their own lives. So if our clients are the experts on themselves and their own lives, they know their pronouns. They're going to know their pronouns better than I will ever know their pronouns. And if we want to talk about person-centered services and we want to be person-centered, well, that's just the starting level of respect is using someone's pronoun and referring to them as they want to be referred to. It's really just basic common courtesy. And as Reverend Sue says, it does save lives. We know that suicidality goes down in trans youth the moment that folks start using their pronouns. It's a huge, huge, huge win for the anti-suicide movement. It's also something that we as counselors want to work on. And to Sue's point, I don't know if the, sort of the Zoomers today are, going back to the 1800s. But certainly if a package comes, I say, oh, what did they deliver? We use they very often. None of this is new. We're just using language in a way that's more inclusive.
Thanks. And how about you, Ronald?
So for me, the usage of pronouns is really about identifying individuals and having them have a voice, having them be seen, whether it's in the workforce, whether it's in our communities. As Matthew said and Reverend Sue said, that idea of being able to give respect to individuals and having them be part and included in the conversation, that starts at the most fundamental level by acknowledging who they are, having them feel welcomed at the table, the proverbial table that we always talk about, people wanting to come to it, be heard at. Well, that starts by acknowledging that individual, and you acknowledge them by acknowledging who they are. And that comes with pronoun usage and the correct pronoun usage.
So what I'm hearing y'all say, in many ways, it's a matter of just being accepted as who you are and who you present to the world, and how you feel comfortable, and yeah, that sense of acceptance and that sense of belonging. That's a lot of times we hear, I know even around different programs and agencies, we're talking about diversity, equity, inclusion, belonging. Well, if you want to belong, you want to be accepted, and this is a big part of that. I get the impression. Would you agree?
Absolutely.
Yep.
So a little bit more into the statistics. So, and I want to ask this of you, Reverend Sue. So, in terms of LGBTQ youth, how do you see the statistics I've referenced in terms of the youth that you work with, maybe here in Buffalo? I know the numbers are remarkably high in terms of depression, anxiety, substance misuse, suicidal thoughts. How do you see that reflected here locally?
I think the Trevor Project did a great job in gathering all kinds of data and information. And it does reflect back to things we see here. GLYSN, the Gay, Lesbian, Straight Educational Network, which is also a national program, did a climate survey in 2019, and a specific one about schools. And similar to the things that the Trevor Project talked about in terms of LGBTQ populations and the high ratio of suicidal thoughts, ideations, and also attempts, the GLYSN Project also shared that 59.1% of respondents shared that they were not safe at school. They did not feel safe. 32.7% of respondents shared that they often missed one or more days of school because of that feeling of unsafety. And 47% of respondents said that they didn't feel they had a resource to talk to in their schools that they felt was a safe space to talk about being LGBTQ. In parallel with what the Trevor Project has talked about in terms of the other aspects of mental health, these components also go forward in leading into where young people start to have mental health, emotional issues as well. And it clearly reflects what we see here in the Buffalo and Western New York area of what many of our young people are experiencing. Now we add on to that the aspects of COVID with anxiety and other components, and we're seeing a heightened amount of young people, and of course, I'm sure Matthew will speak about this as well, the overwhelming need for services, and especially services from practitioners who have been well trained in being able to verse with an LGBTQ young person or family.
Thank you. I want to remind our viewers, if you have a question or comment, you can feel free to type it into the comment box, and we'll try to address it as best we can. So I want to actually ask you, Ronald and Matt, if you have any follow-up to that that I just talked to Reverend Sue about.
So so when we look at what Niagara Pride has been doing and looking at the local area, something that Sue just touched on, even though it was more with regards to youth, we did a community needs survey for 2021 where we asked the LGBTQ population in Niagara County to evaluate and talk about their experiences in terms of safety and how inclusive and welcome they feel in terms of mental health providers, housing providers, local politicians, different types of community service organizations and providers. And one of the alarming statistics that I think we walked away with is that feeling of safety, 39% of LGBTQ individuals in Niagara County who identifies LGBTQ said that they would not go to the police or to law enforcement because they don't feel safe. And so I think that speaks to what Sue is saying, that from a young age, if they're experiencing bullying, if they're experiencing harassment, if they're experiencing those things of not being welcome and not feeling safe in their environment, it then translates into adulthood where we think that law enforcement, if you're having an issue, that's who you should reach out to. Oftentimes, law enforcement is utilized when there is a suicide call or a crisis services call. They're sent out into the field, and yet the LGBTQ population, 39%, indicate that they would never talk to the police, never want to engage with law enforcement. And so that's just, again, an alarming number locally when we look at how do we deal with suicide rates, when we talk about individuals needing help, when the folks that are sent in to help in a crisis can't get through to the individual because of that barrier of fear, of stigma, of potential discrimination. And on the one other thing that that survey, the Trevor Project survey did that to me is an alarming statistic, is that every 45 seconds in the United States, an LGBTQ youth attempts suicide. And for the audience that's listening out there, I just want to repeat that again. Every 45 seconds, an LGBTQ youth attempts suicide. That to me is absolutely mind-blowing. That is a statistic that I don't think gets the national attention and the coverage that it deserves. And we're talking today about LGBTQ and mental health and stigma. I don't know what else of a statistic we need to look at when we see that. So
really to drill down on that, we've been on for nearly 15 minutes almost. So that means that at least 20 youth. I mean, to put that even to more concrete numbers, which is I can't even imagine. I mean, and that's the whole piece about the impact of how I think in many ways, and just societal standards and how this, like I said, the stigma and what people deal with every day. And so, Matthew, do you have any comments on that?
Yeah, so I think it's really important when we're talking about LGBTQ mental health, that the mental health is not because someone is lesbian, gay, bi, trans, queer, intersex, asexual, questioning, two-spirit. It's because the queer community is living and functioning in a society that is very much continuing to marginalize them, and that creates the extra stressors. So it's not because of who they are, it's because they're trying to live and to survive, and we're trying to live and survive in what is often a very hostile environment, especially as the needs surveys have shown, and as the Trevor Project and as GLYS has shown. It's not, there has been a lot of progress, and I don't want to at all discount that progress. And yet, there's also still a whole lot more work to do. And one of the things that we often hear is, well, this is really new. Well, all of a sudden, it's a trend, it's a fad. No, it's that youth have access to the internet, so they've created online safe communities where they can express their identity. And then the way they want to translate this into their day-to-day lives at school, they're bullied, or there's fear of being outed, or there's fear of not being accepted and becoming homeless and kicked out of their homes by their parents. So there's a huge disconnect between the services that a lot of the LGBTQ youth need and LGBTQ community in general, and then of course the stigma that blocks them from getting the services, as well as those very real fears of repercussions if they are who they are and if they are able to be their full selves. In addition, we look at this concept of access, and unfortunately, the LGBTQ community is portrayed in the media as being very wealthy and very well off, and very often it's actually more of a marginalized community, and so that there is less resources, less ability to access services, and that becomes really problematic when we're trying to get more people the help that they need.
So we did have a question coming through, and this is for anyone. Can we compare these statistics with the general population in terms of the youth I was talking about? Of course, we talk about these startling numbers with youth. What about with the general population? I don't know, Matt, if you're equipped to understand or know, comparatively speaking, for youth, maybe how those statistics, or even Ronald, considering you're more in the behavioral health world specifically.
So I don't have those statistics in front of me. I'm sure I can get them. We do know that suicide is unfortunately prevalent, but as it compares to LGBTQ youth versus the general population, I don't want to just make up numbers on the spot. So I would have to look up those numbers. Ronald, do you know them off the top of your head?
I do not, and I was hoping that I could go in really quick and look at some of my resources, but like Matthew, I don't want to give inaccurate information. So I'm going to say we can provide that later on, or if folks want to contact any of us, we would be more than happy to get back to you with those kinds of numbers and statistics.
What I would add, though, is that it's not a case, it's really not the suicide Olympics. It's not a case of, is it more or less? It's the fact that there is a very defined population that is experiencing high instances of suicidality and suicidal ideation and suicidal attempts. And it requires a special treatment team who has experience working within this community. So the general population should be given all of the services the general population requires, and the special marginalized community should also be given all of the resources that the special marginalized community requires.
Well said, Matthew. I was just looking up on NAMI, National Association of Mental Illness, and just some of the stats that they had there as well. But I think I'd go with what Ron and Matthew have just said, is that when we work to not pathologize being LGBTQ and look at the greater population of all people who are suffering from mental illness, then we're better able to start those doors of opening for inclusivity. But we already know from the stats that have been shared just how high the percentages are in the LGBTQ community. And equally, there are large portions of individuals across the span of sexual orientation and gender identity who are in great need of mental health services.
Absolutely. And I would add to that too, substance abuse services. Very often, one of the ways that folks turn to cope is through substances. And we know that there is a high rate of substance use in the LGBTQ community. And we also know that it's very often all of these things become associated with each other, and they create sort of the exponentially traumatized individuals. So we have the stigma, we then have, unfortunately, homelessness, we have mental health concerns, we have substance use, and so we have to really work to remove the stigma so that folks do have more options.
So another great question in from our audience. So what safe resources are available for LGBTQ plus individuals, as well as youth, needs to get adequate services in Niagara County besides crisis services? So I'm going to point that to you, Ronald, considering you're in Niagara County.
So we in Niagara County, we, for lack of a better phrase or term, and I know this sometimes upsets some people, but we are kind of in a desert of services. There, when we look at the county, the way it's kind of been structured, we have Niagara Falls, North Tonawanda, and Lockport. And unfortunately, even if there is a program, and I will mention a few programs, even if there is a program in, let's say, Niagara Falls, the way the county has set up, the way the population has resides in our county, very infrequently do individuals from Lockport or the surrounding Lockport areas want to travel to Niagara Falls. The same is true if there is a resource in Lockport. Niagara Falls individuals will find it difficult sometimes to get to Lockport or be unwilling to travel to Lockport. So with that in mind, even if I mention things like the Mental Health Association, which is located in Lockport, it may provide services, and in fact it does. I know that it has an LGBTQ support group. It may not be getting the true numbers and the population. It's not getting the clientele that it might that really should be accessing it, because again of that perception, or whether it is that that desire by individuals to not want to travel or wanting something more local. So I think a lot of services go underutilized and do not get the appropriate attention by the community that they need. So with regards to, let's say, like Lockport having the Mental Health Association, in Niagara Falls, there are agencies like Planned Parenthood that have established something called The Connection, which is an amazing program. It's an after-school program where underserved youth can go and have a safe space to learn different skills, to hang out. It acts as a drop-in center. It does programming for and is inclusive of LGBTQ individuals as well as other minority populations. But again, to that point, that The Connection is an incredibly wonderful resource that does not get individuals from North Tonawanda accessing it. It does not get individuals from Lockport accessing it. So I would say that even though there are those resources available, that's kind of the problem that we are facing. And if I can speak a little bit to some of the things that we've tried with GLYS, where we've tried partnering to have some drop-in centers or have some type of momentum in order to build drop-in centers or youth programming, that's really the challenge. Unlike Erie County, where Erie County seems to understand that services centered in Buffalo, people will go into downtown Buffalo. That's not necessarily the case in Niagara County. So even though there may be services, it's still incredibly difficult to access them at times.
Okay, thank you. Thank you, Ronald. If you're just tuning in, I'm Karl Shallowhorn from the Erie County Anti-Stigma Coalition, and I'm joined by licensed clinical social worker Matthew L. Schwartz, Reverend Susan Frawley, parent and community outreach coordinator for GLYS, Gay and Lesbian Youth Services, and Ronald Piaseczny, founder of Niagara Pride. Remember, you can visit our website at letstalkstigma.org to take the pledge to end stigma. Also, if you're connected with a business, organization, or faith community, you can become an organizational member of the Anti-Stigma Coalition. You can find information for this on the website under the Members tab. So once again, if you have a question, you can feel free to type it into the comment box, and we'll try to address it as we can. I want to go back to you, Ronald and Matt, regarding health professionals and especially behavioral health providers. Why do you think it's so important for this group of professionals to understand individuals and who identify as LGBTQ+? I mean, you would think that it would be something that would be well understood, but unfortunately, I don't think that's always the case, and even anecdotally. So, can anybody, either of you, maybe?
Yeah, I can start.
So you're chomping at the bit, aren't you, Matt?
Yeah. So the medical and behavioral health professionals, many of us try our best, and unfortunately, no one is perfect, and certainly our fields have a lot of work to do. We have to decolonize the field of social work from racism and institutional racism, sexism, misogyny. Social work's roots are part of where it is today, and we do a lot of great work, and there's a lot of work to do within our field. When I've educated fellow clinicians, some are shocked that they may have to write a letter for gender-affirming surgery. And it's like, literally, this is a basic thing that you can do. There's a template, it takes 2 seconds. Well, I don't feel comfortable. Well, you're working with this patient. There is an ethical obligation to provide care, and you're standing as a barrier towards helping your patient affirm their gender identity. That's a huge problem. When we look at medical professionals, unfortunately, medical doctors should be asking about, sexual intercourse, HIV testing, does someone want to be on PrEP, whether or not someone is sexually active, whether they're sexually active with one partner or multiple partners, whether or not they are engaging with sex workers. And unfortunately, a lot of doctors, because they're humans like everyone else, though, sometimes they think they're superheroes, is really that they're embarrassed and they don't ask the questions. They don't ask what needs to be asked. And it comes from a lack of training. Sometimes it's personal, political, or religious conflicts that follow them into the office. Sometimes, especially with behavioral healthcare providers, it's even just feelings of self-efficacy that they don't want to say the wrong thing versus learning how to say the right thing by making mistakes, being gently corrected, and then moving on. The problem is that one bad incident can stop someone from going to therapy for the rest of their lives. And medical professionals, especially physicians, nurse practitioners, and physicians' assistants, literally physical lives are in their hands, to say nothing of the mental health concerns that happen when someone can't have gender-affirming surgery, when someone isn't able to get on PrEP. These are huge concerns. And for us to act ethically as behavioral healthcare professionals, as medical professionals, as mental health professionals, the whole community, we have to be able to work with all of the communities that live within the areas of our practice. And we can't, there's no such thing as cultural competency. We can't be experts. I'm not an expert in any of my cultures, but we can be culturally humble and ask our patients to teach us how to work with them. And I think that we need a real push to do that.
I agree that idea of humility and not trying to be the expert is really key when it comes to working with all populations. So, Ronald, do you have any follow-up to that?
I think everything that Matthew said, I 100% agree with. I think for me, it boils down to one simple equation, in that better understanding, better knowledge, and having that that entire toolkit at your disposal of diversity, equity, and inclusion yields better outcomes. I think it's as simple as that. The more knowledge you have, the more you're willing to learn about diverse populations, to embrace diversity and inclusion, and look at the different health needs and unique challenges that your patients, your clients, your consumers are coming into the office with, will ultimately yield a better treatment outcome and a better outcome overall for that individual. So I think it's really, for me, it's a simple equation, but I know, as Matthew said, all of those things that come into that front half of that equation, there's a lot there. It is a lot to unpack all of that. And it is not easy. No one is saying that it's easy. It takes a lot for individuals to get to the point where they're doing these internal self-assessments and assessing their internal biases and going through the trainings needed for all of this. But in the end, it is so critical to the LGBTQ population, as well as to other minority populations that have been marginalized in healthcare.
Thank you. So I have a question for you, Reverend Sue. This is another one from the audience. If you have a question, please type in the comment box and we will try to address it. But this is for you, Reverend Sue. Has progress been made in the religious community to help in this area, and what else needs to be done?
That's a great question, and it's so big and it's so wide, because when we talk about religious community, there are so many different homes of faith that have within them various attitudes and ideas about LGBTQ individuals. I would say generally, in some of my experience in working with local clergy and local faith houses, that there has been progress, but not enough. And part of this goes back to being open to look at what it is that congregants are bringing forward, training for clergy in terminology, and also that balance of where the faith root meets with the personal aspect of the individual in their sexual orientation and gender identity. And these are not easy dialogues or teachings to do, but I am impressed with some of the bigger seminaries, like locally or other, that have really been trying to address this. Sisters of Mercy have done an amazing job of creating a SOGI committee that is addressing this and then extending that further into a lot of the religious homes where they are doing services across the United States. But there's a lot more work to be done, in part because this has been an area of trauma that has then influenced and affected the mental health of many individuals as they come upon their journey to become their whole and authentic self.
That's very interesting, because when you talk about being, your true authentic self, you would think that your place of worship is where you could do that, but we know that's not always the case in some instances. So that's a very good point there, Reverend Sue.
Karl,
I have a
can I
question
just
for all of you. Did someone else want to say?
Yeah, Karl, if I can just jump in for
please.
really quick and do a small plug. It's actually what Sue just indicated is something that Niagara Pride has believed in and has been working on. And we actually have been trying to meet with local faith leaders. We did a Pride Interfaith ceremony last year as part of our Pride celebration. And we have started the work of creating a Western New York Pride Interfaith Committee, so that if there are spiritual leaders and organizations that wish to continue that dialogue and learn how to be more inclusive and affirming of their diverse congregation, especially with regards to the LGBTQ population, we encourage people to check out the Pride Interfaith Committee, become a member, attend some meetings, and see how individuals can expand on exactly what Sue indicated in terms of the spiritual community.
How can individuals find out more about that, Ronald?
So if they go to our website, www.niagarapride.org, we do have, as part of our collaboration tab, you'll see that there is the Pride Interfaith Committee. Or if folks want to email me, they can do so at info@niagarapride.org, and I can send them information.
Excellent. That's a great resource. That's really good to know about. Thank you for sharing that. So I want to get to something, then this is once again for all of you, and this kind of weaves into a lot of what we've been talking about already, and it has to do with discrimination against the LGBTQ plus community. As far as how this contributes to the mental challenges that individuals experience, what are some of these particular challenges that you see when it comes to stigma, which is related to discrimination? How would you say that correlates to mental health?
So, Ronald, you want to go?
Sure. I feel like this topic, Karl, is this could be an entire week-long, if not semester-long class at a university.
Well, we only have 26 minutes, so let's try to keep it concise.
Perfect. I'm on it. And as my husband will say, good luck with that. So what I think some of the big overarching issues when it comes to when we look at societal stigma and the impact, we look at things like there are no federal laws that exist that cover LGBTQ individuals. We know about things like Title VII of the Civil Rights Act. We know that certain individuals, protected classes exist, such as your race, your national origin, your religious background. All those things are protected by Title VII, yet sexual orientation and gender identity are not. And those are things that have been won over time through court cases, and only certain states have actually implemented sexual orientation and gender identity into their state laws and protections, with about 26 states in the US actually having things on the books, such as laws or policies with regards to that. We've had a string of cases, most recently, that have been very supportive with marriage equality. We had a case last year where it was decided by the Supreme Court that employers cannot discriminate based on LGBTQ status. However, late last year, 2 Supreme Court justices in an interview actually stated that they made a mistake. The court made a mistake by granting marriage equality, and that given the chance, they would probably overturn it. We look at when states like Florida and a whole plethora of other states right now are passing anti-trans legislation, the Don't Say Gay bill that's in Florida. When you think about what that means for an individual to potentially live in a state where they have no state protection, whatever rights they have could be taken away at any moment by a court decision or overruled. When individuals are going to school, when youth are going to school and now being told that they can't mention their gender, they can't talk about it, everything is even with the intention of it being more cisgendered or heterosexually oriented. The intents of those laws are to promote heterosexual things that are okay, but you don't want to talk about different gender identities or sexual orientations. That is the true intention of those laws. All of that begins to weigh on an individual, not to mention that there are certain things like housing discrimination, employment discrimination, financial discrimination. We do a training where we talk about, in some states, there are some banks that have actually, it's been discovered that some banks, if a same-sex couple walks into a bank compared to a heterosexual couple, everything being equal in terms of income, their employment status, all of that, the bank could potentially charge an LGBTQ couple higher interest. And again, some state laws prevent that, some don't. So when we look at that, the totality of all of those things weighing on an individual, it's kind of no wonder that the LGBTQ population has more depression, more anxiety, when on a day-to-day basis, if you have to hide, if you have to shield yourself, if you have to worry, is tomorrow the day that my marriage is going to be, my union is going to be disallowed by the United States? Will I be fired tomorrow if I come out and my boss finds out about me? Will I be thrown out of my apartment and have nowhere to go because there's no housing laws that protect for against discrimination? We can start having the conversation about how to treat LGBTQ mental health and physical health, but having that as, I think, the overarching umbrella and context for the conversation is incredibly important.
Yes, and to build off of what Ronald said, when we look at that, that's not even taking into account intersectionality. If we look at, who's most at risk right now, Black trans women are most at risk of being murdered with impunity, with absolute impunity. The list last year was larger than those of the veterans or veterans killed in Iraq for that year, which was just no one should die, but it was just shocking that it happened here in the United States. And when we also look at it, we look at families or LGBTQ families. So then, if the parents are stressed, the kids get stressed, there's a palpable feeling of it. It creates issues at school. It's like taking a little pebble and throwing it into a pond and watching that ripple effect. And when we look at it from a mental health perspective, it becomes, even at sort of the unintentional discrimination that exists. So for instance, the doctors, I don't specialize in that, or I don't specialize in your kind of family. Or the therapist, I've never worked with the LGBTQ community. No, you need a different therapist. And so what happens is there becomes this real dearth of access to services. And I don't like using the word desert, but I do like using the word apartheid. And so it really becomes a service apartheid because it's intentional. And what happens is that families suffer and communities suffer. And at the end of the day, we as a country, we as a community do better when everyone is healthier, both physically and mentally, and when those who have those needs met. And basically the political climate has gotten so charged that it is fomenting not only a divisive climate in this country, but also a climate in which people are scared, anxious, depressed, and turning to substances for relief. And unless we make those changes systemically, politically, and as a community, we're going to have an even larger problem on our hands.
I want to follow up actually with you, Reverend Sue, go even a little bit deeper in terms of, so research shows that, youth know their gender identity by age 3.
Mm-hmm.
So how do you think this affects that mental health someone who's forced to repress this identity as they get older? We've kind of touched on this a little bit before, but with you working with the youth that you do and what you see, how do you see that affecting their mental health?
Yeah,
in terms of being ostracized.
Right, and just to cite where that stat comes from, it was a Mayo Clinic study that was published and put forth, and actually just recently again published in February of 2022, that talked about where that aspect of gender identity starts to form. It actually stated that the formation can take place from ages 18 months to 24 months, but with solidity occurring at about age 3, and then sharing out at ages 5 and 6. And why is this important? Because within that study, they also determined that much of the gender identity that was reported out for 5 and 6 was oftentimes in compliance with what was the anticipated and expected gender identity of the community, of the family, of the religious community, on and on and on that went with this. These are important stats because some people think that, oh my God, my kid's going to go to school and somebody's going to change them. They're going to see a man in the bathroom and they're suddenly going to become transgender, or something's going to occur. And the reality is, for young people who are transgender, they know that early on. The question is, are they in supportive environments that are going to help them to be healthy and whole, or are they going to have to repress that authenticity and possibly have other types of comorbidities that are going to come into their existence that are going to affect their emotional, spiritual, psychological, and physical health? And this is still being argued about. Oh, kids don't know, kids aren't aware. Well, look at all the gender reveal parties that go on television. There is so much of a pressure of, we need to know the gender. And then once we know the gender, what color will that be? And what other presents go with that? And I'm here to tell you that there's more than 2 genders. And the fact that there is more than 2 genders, well, wait a minute, Sue, that sounds like blasphemy. Wait a minute, you're not a medical doctor. No, but the Mayo Clinic and others have shared, there's male, there's female, there's intersex, there's transgender. And then when we get into gender identity, there are almost 73 different components by which individuals, remember, it's identity, not you-dentity, meaning that the individual decides for themselves, based on their best knowledge, what is that gender identity. New York State right now is amazingly progressive with the passage of the Gender Act, which just went into effect this past January. Now, birth certificates do not have to say male or female. They can also have an X. There can also be a blank line on New York State forms, where in the past, demographic data used to be collected that had to say male or female. And again, with the X, it really helps for intersex individuals who are born. It's about as common as the amount of redheads that are in our United States. And also for individuals who are in transition, which their New York State documents can now reflect back who they genuinely are. But again, to get back to the point of your question, Karl, yes, children are aware. Whether or not they are supported, that's the question. And in Western New York, we have a variety of places, including for GLYS, that offers supports for young people, for parents, and for the communities around them in terms of educating medical offices, schools, and other community partners who want to be those affirming spaces.
I have another important actually follow-up to this, Reverend Sue, because this actually directly applies to what you were just saying. The question came from our audience. Do you have any advice to give to parents or other loved ones who have a LGBTQ person in their life who might be struggling with mental illness?
Sure. And I would say to that, whoever, please give GLYS a call. We have a YGAP, which is Youth Gender Affirmation Program, with a case manager who's able to do intake and connection. We also have a partnership with Child and Family Counseling Services, where we have trained counselors who know how to do the narrative with LGBTQ youth. And here's an important part. It's really hard to find a counselor that'll see somebody who's under 12 years old in this area, but we have access to those individuals. So if you call to GLYS or to email to me, we're happy to give you the referral to the connective places. And just as Matthew talked about, and I think Matthew will be speaking about it again, every place is suffering from this lack of open spaces because COVID and other things have affected those frontline therapy workers so much that we don't have as many as we used to. So there is a bit of a waiting period. There is a bit of a reduction, but there are people out there and there is a way to create access. And I would say just reaching out and speaking to someone who can start you on the journey is the first part of that path.
So that's really excellent information too right there, Reverend Sue. Another question from the audience. These are great questions coming through. If you have a question, we have a little time left. Feel free to put it in the comment box and we'll try to get to it. This question is, what can towns and suburbs around the city of Buffalo do to help with awareness? So I guess, I don't know if I want to direct that to you directly, Ronald, but also Matthew, you might be able to help, or even Reverend Sue.
So I would say that in terms of what can the towns or different government agencies do, let's start with that. I think that there can be a lot done in terms of internally diversity trainings. Take a look at your policies, take a look at the different forms, the different points of contact and entry that maybe somebody has into a government office, where if it just means updating your forms to be more gender neutral and more welcoming, whether it's educating staff about the different things like SOGI and how that can come into play with different people that are coming into the to that office to access services. And then looking at how do you develop programming and I'd like to say holding politicians accountable, that when they do their budgets, when communities look at what politicians are maybe passing and the legislation that they're trying to do, if there are, even on the most local levels, budgets that are not supportive of different programs, whether it's for LGBTQ people or diversity in general, do you want to continue supporting that, or do you want to try to find policies and funding that will, again, promote different diversity programmings, different support systems like crisis services, like counseling, so that, again, these things will be funded and that people can access them and have easy access to those different programs. Beyond that, I think part of it is also developing partnerships. I want to say that Niagara Pride, I think, uses a model that is really effective in that we try to build partnerships with other organizations and agencies where you may not think that that partnership would normally come about, such as, let's say, Niagara Pride along with Niagara County's workforce development. One is about jobs, one is about advocating for LGBTQ individuals and providing services. But the nexus between them is that, again, we look at employment, we look at how to promote diversity, and having agencies meet with one another, have those conversations, figure out dialogues, and how to provide diverse programming, I think, is absolutely critical.
Yes, and I would add to that, I think that all politics is local. I really do. And I like to think of my block as a really great example. I know what I want my block to look like, and sort of to draw from one of my favorite movies, Pete's Dragon, there's room for everybody if everybody gets up and makes some room. I don't think anyone's asking for anything more than equal rights, and sometimes that's misportrayed or even maybe misfelt as, the LGBTQ community asking for more than. And I think that really we have to decide what kind of communities do we want. Before I was in a clinical social worker, I was in business, and every Harvard Business Review study shows that organizations that are more diverse have a better bottom line, hands down. And so I think that it really starts at a very local level. It starts in our homes with the words that we do or don't use. And no one's talking about home policing or, canceling anyone. It's, would you want to talk, how would you want to be talked about or spoken to or spoken about? Using the language that we want to show our neighbors that we care, using pronouns. That's what kind of society do we want to live in? And when we take those small steps, they turn into larger steps where we can also then reduce stigma, make people feel welcome, recognize that it's okay to disagree, that we can have diversity of both individuals, orientations, gender, thought. But it really takes a village, and it takes a village that right now is very divided. But we can come together and we can agree to work to make the kind of community that we want. So I think that if we're looking at what towns and suburbs can do, it's just starting in our own homes with our own language, with our own friends, and moving from there.
I would just piggyback onto that, especially because I've had two instances. One being a minister in Hamburg. I had the pleasure of working with Councilwoman Karen Hoke, who had the idea, let's create something in our village, with our town. And so last year, the very first Hamburg Pride took place. And it took a lot of work to speak with people who were somewhat resistant. Shout out to Mayor Moses, who just left office, but really was the mayor of the village who helped to bring that forward. And now Town Supervisor Randy Hoke, who is going to raise the first Pride flag ever in the town of Hamburg. And it was those coming together of people in the community who wanted to create things, just like Ron talked about, the partnerships that created something for the people there. It's about thinking globally, but acting locally. As we say at our church, ministry on the block. When you look out your door, literally right around you, what is there? And another great example is in Clarence, where they have a family support center that Evan Varatian has come together and brought all the people in the community. And Evan's brand new to Clarence, and I'm just so amazed. But he's brought people to the table to talk about concerns and issues, especially about LGBTQ concerns. And this includes the librarians, which is a perfect, oh my gosh, here's a place where everyone is already meeting and gathering. And sometimes we undervalue our libraries and the resources. But here is a space and a place. And then bringing in our youth recreation programs. And again, along with this, it comes to trainings. It comes to preparing for that narrative so that when a young person comes to a program, the people there know how to use pronouns. They don't automatically assume that they come from a heteronormative parent or home. And when they make groups, they make them creatively. It's no longer has to be a binary. Sometimes it can be not a boys line and a girls line. Let's make 3 lines: pizza, hot dogs, and ice cream. What do you like? And it makes for just changing practices. It's about reimagining. So every town and every suburb has the potential to do this. But it does take somebody from inside that space to be the conduit, working together in collaboration. And there's certainly places with Niagara Pride, with GLYS, with other, that we can help make that happen. And then that community becomes its space, and little by little it grows, and everybody gets healthier.
I love it. So that's wonderful, because we all, I guess, that kind of goes back to acceptance, we talked about, right? So I actually want to ask you, Reverend Sue, the last question before I ask for closing comments and remarks. Now, many people say, oh, well, I have a friend who's LGBTQ. I get it. Well, is that really the case? And so, in other words, how can someone be a true ally? How can I be a true ally in this whole idea of support, which of course is a key element here? How can someone be an ally?
It's a great question. I'm a 63-year-old lesbian. I've been gay my whole life. But even now, as I'm learning things about our young people, I have to re-educate myself. Their experiences are not the same as experiences that I had while younger. So for a person who is heterosexual, an ally, they really have to do an intensive dive into looking at what are the concerns and issues. And there's certainly a lot of forums and places to be able to do that. Just because you know somebody doesn't mean you know all of the journey, know all of the history, know all of the trauma. To be the same, it would say, well, I have a friend who's Black, so I understand everything about racism. And we know that that is definitely not true. So, and each person, again, is different in the LGBTQ community. So knowing one person doesn't give you the total picture. But again, if you were to contact the GLYS or Niagara Pride, we have lots of ways to help, to educate, to connect, or even, going to events, being present, and doing whatever you need to do to just know a little bit more than just a person.
Love it. That's wonderful advice. So I want to take a moment now to offer you each a minute or so to give some closing comments, any last reflections, anything you want to share that perhaps we didn't talk about already that you really feel is important for our viewers to hear. So Matthew, I'm going to start with you.
Sure. First, thank you for having me. This has been a pleasure, and pleasure to be on with the other panelists. And I think that what I would add is that it's okay to fire your therapist, and it's okay to try out your therapist. 85% of what makes therapy work is the connection. There's some between 200 to 600 different kinds of therapy modalities, and they're actually far less important than the interpersonal relationship with your therapist or your counselor. And it takes a while to find someone. So please reach out. Please don't give up. Please keep on working on your mental health. Our brain is an organ, just like our heart and lungs. And just like you take your heart and your lungs into the heart and the lung doctors, sometimes you got to bring our brain into the folks who specialize in how our brains function. And the more that we talk about it, the more that we talk about going to therapy, the more that we reduce the stigma of needing therapy.
That's wonderful, wonderful, wonderful advice. I love that idea. The therapeutic relationship is so important. Absolutely. Ronald, how about you?
So I think I just have two points, and I want to start off by saying thank you for inviting me today. I think this panel has been absolutely incredible. It's a pleasure to have had this opportunity to speak with Reverend Sue and Matthew and Karl as the mediator. Thank you so much for this opportunity. First, I just want to say I think when it comes to looking at how can we make the world a better place for diversity and inclusion of all individuals, I think that's really the work that comes to an individual level. It's doing that hard introspection. It's when you talk about being an ally, what are your implicit biases? What are your thoughts? What are the things that you value as a person? And when you're saying that you're going to support a particular politician or a particular policy, are you truly supporting the people and the minorities that could be impacted? Or are you doing it because it's better for your pocketbook or it's better for XYZ? And you have to make that decision for yourself, but make it informed and be honest about why you're making that decision. And then the other part that I just want to say is I think when it comes to resources in the community, there's no wrong door. So whether you come to GLYS, whether you come to the Niagara Pride, whether you come to Matthew's practice, just if you need help, if you need to start asking questions, reach out to any one of us and we would be able to direct and refer people. Don't feel that you have to go to somebody who necessarily specializes in one particular thing. Call, ask the questions, and you will get to the place that you need to be.
Thank you. And I'd be remiss if I didn't give a plug for the Mental Health Advocates of West New York, who also is a great resource to call just for general information regarding behavioral health and mental health treatment. Reverend Sue, last words.
You're not alone. Whatever journey you're on, whatever you need, there's 3 points of contact right here, right now. Just reach out and we will help walk you through that journey. And that's probably the most important thing to hear, because it can feel like you're alone. It can feel like you're the only one. You can feel isolated. But we are here for you and we would like to help.
And that, I think, is the We've heard a lot of good things, but that's the great thing to end on, that you're not alone and that you can be heard and that you need to be heard and you deserve to be heard. So thank you for that, Reverend Sue. So I want to thank you, our audience. And so as a reminder, we need you to take the pledge to end stigma by going to our website, letstalkstigma.org. If your organization would like to join us in our cause, there's information on the website as well. Just click on the members tab to find out how. So together we can all make this happen. Once again, I'd like to thank our panelists, Matthew L. Schwartz, Reverend Susan Frawley, and Ronald Piaseczny. I'd also like to thank the folks behind the scenes, Mike Telesco from Telesco Creative Group for his behind the scenes technical support, Matt Smith, chair of the Erie County Anti-Stigma Coalition Outreach Committee, Carol Doggett from the Mental Advocates of Western New York, and Karen Piaseczny from KKPR Buffalo for their support as well. Now, special event, May 25th at 8:30 a.m. We'll be celebrating the 5th year anniversary of the Erie County Anti-Stigma Coalition at the WNED studio. So please stay tuned and keep an eye on our Facebook page for more information. So on behalf of the Erie County Anti-Stigma Coalition, until next time, I'm your host, Karl Shallowhorn.